Hello everyone, welcome back to Anshul Gupta MD, your trusted resource on everything related to thyroid. Several people with thyroid disorders, whether it is hypothyroidism, Hashimoto's disease or even hyperthyroidism, suffer from thyroid muscle pain, muscle weakness and joint pain. And even after taking the conventional treatment modalities, these pain and weakness doesn't go away. So today I'm going to first explain to you why this happens and what you can do to improve your weakness and your pain. So let's get started. So why do this thyroid muscle pain and joint pain happens and also the weakness happens? So the reason is that thyroid hormone is very important for keeping your muscle in good shape. Whenever your body doesn't have enough thyroid hormone or when it has excess amount of thyroid hormone, your muscle gets damaged. In low thyroid condition, your muscle fiber do not regenerate and that's the reason you feel pain and weakness. In hyperthyroid condition, your body is breaking down excessive muscle and that's the reason you get muscle pain and weakness. Now the similar thing happens in joints also. In joints, your joints are lined with this cartilage which safeguards your bones from rubbing with each other. As well as there is joint fluid which is present which has anti-inflammatory chemicals into it. Now again, when your thyroid is affected, these cartilage are not able to regenerate or they get destroyed excessively because of the inflammation of the thyroid gland in Hashimoto's disease or in low and hyperthyroid condition, and that's the reason this joint pain happens. The second reason of the muscle pain and the joint pain is also fluid retention. Most of the people with thyroid disorders have something called fluid retention. They have excessive amount of fluid accumulation that happens in their joints as well as in their muscles. And because of this excessive fluid accumulation, they always feel bloated all the time. And that's the reason this joint pain and inflammation and muscle pain also happens. The last reason of all of these symptoms is poor mitochondrial health. Mitochondria is the powerhouse of your cell. Mitochondria also keeps your bones, your muscles and all the other organs of your body in good shape. And whether you have hypothyroidism or Hashimoto's or hyperthyroidism, your mitochondria are not functioning properly. And that is the reason that you have this pain and inflammation going on. So now you know the reason why you're having pain and inflammation as well as weakness in your joints and muscles. Now let's talk about what you can do today to improve these situations. So let's first get started with the lifestyle changes that will definitely help you improve these symptoms, and then we will talk about natural supplements that will definitely improve your symptoms. So let's first talk about the exercising. Most of the people have been told that exercising is really good for them, but most of the people with thyroid disorders are not able to exercise because of the joint pain and the muscle pain, right? So it is very important that do not push your body too much. High impact or high intensity exercising is not good for thyroid patients. So do not do them. So start with low intensity exercising and as well as exercising which supports your joint pains as well as your muscles. What that means is that if you start doing some yoga exercises or if you start swimming or water-based exercises, that is really good for your body because that supports your joints as well as your muscles and make them stronger. The second thing you do is that you do very light strength training exercises. Again, they build up your muscle and makes them stronger. And these light strength training also doesn't give you too much pain. And then once you're comfortable with a low impact exercising, that's where you start doing more cardio or aerobics or high intensity training. So it is very important to start these exercises first before you jump into any vigorous exercise regimen. The second thing you need to do is do a proper diet. Now food is very important to maintain your thyroid health as well as your muscle as well as joint health. So what kind of food is good? Obviously eating an anti-inflammatory diet by removing foods which are bad for your thyroid like processed food, fried food, gluten, dairy is important. But on top of that you need to include food which is specifically good for your muscle and your joints. So out of that, the first food you need to include is good quality protein. Now whether you are a vegan or a vegetarian or even a meat eater, you can get good quality protein. So if you are a meat eater, then get chicken, fish and turkey, or organic grass-fed beef is also good for you. If you are a vegan or a vegetarian, then you might need to rely on vegan sources like your nuts and seeds like almonds, like walnuts, like pumpkin seeds, chia seeds, flax seeds, as well as your lentils, your legumes, your beans, your chickpeas. All of those are great sources of good quality protein. So make sure you are including good quality protein with each and every meal, including breakfast, lunch and dinner. In that, protein powders are also good sources. Even collagen protein powders are good to help you improve your muscle health. That's the first thing from the diet aspect. The second thing, you need to include anti-inflammatory foods. In that, green leafy vegetables are very, very important. People have been told to thyroid patients don't eat green leafy vegetables, and that is not correct. All of these greens are good for your muscle and your joint pain, so please include green leafy vegetables. Some of the deep colored fruits like pomegranates and beet juices are really good, because that deep color is because of the polyphenols which is present in beet juices and pomegranate juice. In fact, there was a research study done on athletes who drank 1 cup of beet juice on the regular basis, and they saw that their inflammation in the muscles was less, and they were actually able to exercise more by drinking the beet juice. So these are again 2 important foods to include. Then there are certain spices like ginger as well as turmeric, which are good for again anti-inflammatory purposes, that you should include. Fatty fishes, good fatty fishes are also great because they provide you good omega-3 fatty acids. Again, if you're a vegan or vegetarian, make sure you're eating chia seeds and flax seeds to get these omega-3 fatty acids in your system. So these are all the things from the diet perspective that is going to help you to improve your joint pain and inflammation. Now the last thing is the supplements that can be helpful. So the number 1 supplement in this situation is curcumin. Now curcumin is a chemical compound which is derived from turmeric. We know that turmeric has anti-inflammatory properties, and curcumin had shown to reduce inflammation in the muscle and the joints. It has also shown that improves the exercise tolerance as well as improves the muscle strength. So because of all of these things, turmeric or curcumin is a great supplement to use. Now the problem with just eating turmeric in your diet is that you do not get enough curcumin supplement in the right form and the dosage. So it is very important to use a supplement called curcumin so that you can get the right dosage. You need to get at least 1000 to 2000 milligrams of curcumin on the daily basis. Then only it can have effect on your joint pain, your muscle weakness and inflammation. So that's the first supplement. The second supplement that will be useful for you is omega-3 fatty acids. Omega-3 fatty acids, especially EPA and DHA, have shown in research studies that they can improve the recovery time after you're exercising. Now what this recovery time does is that actually it reduces the inflammation in your body and recovers your muscle from any damage that happens during the exercising. So you are able to exercise more, you're able to tolerate exercise more, as well as you have less pain in your muscles and your joints. Again, getting good quality fish oil or omega-3 is very important, and having a minimum of 1000 to 2000 EPA and DHA is what you need to get on the daily basis to improve your joint pain and inflammation. The third supplement is vitamin D. Yes, vitamin D is very important for your joint pain as well as your muscle pain. 90% of people who are walking on the streets are deficient into vitamin D. So it is very important to get your vitamin D levels checked, and if it is less than 40 on the labs, then you need to start a vitamin D supplementation on the regular basis so that this vitamin D levels keep going up for you. The next supplement that will be helpful for your muscle pain and inflammation is Boswellia. Now Boswellia actually comes from Indian Ayurvedic science. It is a supplement that has been used for reducing inflammation, especially for bone pain. Boswellia has great anti-inflammatory properties, especially for joints and for your muscles. So Boswellia is another supplement that you can take on the regular basis that will help you with your reducing your muscle pain as well as your joint pains. The last supplement in this category is collagen. Yes, collagen peptides are really powerful in actually helping you build your muscle as well as reducing inflammation in the body. Collagen also helps with gut health. Collagen helps in absorption of nutrients from your gut, as well as collagen is important for your skin health as well as for your muscle health. So get a good collagen peptide powder that comes in the capsule form or in the powder form. Again, that can help you with your joint pain and inflammation. So you see, now you know why you're having this joint pain and inflammation issues, and now you know what lifestyle things, what is the best exercise for you, and what are the best supplements that can help improve this muscle pain, joint pain, as well as weakness in your body. I hope you like this video. If you do, please like and subscribe to my channel. Thank you so much. Bye-bye.